Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I'm joined today by members of my cabinet as well as two guests. Jacqueline Bowens is the president and CEO of the D.C. Hospital Association, and Dr. Reginald Robinson is a local cardiologist and president-elect of the Eastern States Board of the American Heart Association. So welcome to both of them, who are going to discuss with us how to keep Washingtonians healthy and safe, that is non-COVID related, but is COVID related. And you'll hear what I mean by that later. We're also going to provide just a brief update on our experience with COVID in the district. This morning, we announced 73 new cases of COVID, and sadly, 3 Washingtonians more have succumbed to the virus. We continue to urge Washingtonians to be vigilant, and most importantly, to continue to wear your mask and stay home if you don't feel well. And regardless of whether you feel sick or not, to continue to social distance when you're near people who are not a part of your household. We also continue to make free COVID testing available in neighborhoods across DC, and you can see the dramatic increase in testing that we have experienced in the last 4 weeks. For example, during the week of June 5th, at the DC-supported testing sites, just over 1,500 people were tested. By the following week, that number jumped to almost 6,000 people tested. The week of June 26, 6,600 people were tested. And last week, we had the highest number of people receiving tests at a DC-supported site, with 8,419 people tested. So go to coronavirus.dc.gov to see all the testing sites available to you. We have provided a list of the sites that are available this week and a easy to refer to flashcard. So I hope that you will look at that information. But continue again to follow the advice of DC Health, to wear your mask, stay at home when feeling ill, practice good hygiene with your hands especially, and also to think very carefully and choose your activities wisely. Stay home when in doubt. So additionally, I told you the other week that we would make free antibody testing available, and now we have 2 locations. The original location at Canal Park and now at Tacoma Recreation Center. You do need an appointment for these tests. No appointment is needed at the walk up and drive up testing sites and at the fire stations. So please look at those sites. You can find the schedule in the locations of both testing sites at coronavirus.dc.gov. So with that, now I'm going to introduce Jacqueline Bowens to talk about the DC Hospital Association's campaign about Don't Delay Care. And then we will hear from Dr. Robinson of the American Heart Association's Don't Die of Doubt campaign. We've talked to you before about all of the ailments that people live with in Washington, D.C., that are non-COVID related, and our concern that our stay-at-home posture has made people think that their doctor's offices or hospitals aren't available for other types of care. And we want people to be assured that you should call your doctor, call 911, or go to the hospital when you're not feeling well for any reason. So with that, I'm going to ask Ms. Bowens to talk about the 2 campaigns.
Well, Madam Mayor, thank you so very much for having and inviting me today to participate in this press conference. And before I launch into the campaign, I just do want to take a moment of personal privilege to thank you for your leadership and just all the tremendous work that you've done in collaborating with us. You and Dr. Nesbitt and your entire administration have really been essential to us really feeling not only engage with you, but as a national leader. So thank you for that. I've never been so proud to be a DC girl. So thank you very much for that. As the mayor had mentioned, the DC hospitals have come together in a Don't Delay campaign to really begin to bring the word forward in terms of the importance of not delaying your care. We want to ensure everyone and reinforce that your health must be a priority, that our hospitals are safe and that our doctors are ready and willing and ready to make sure that we are providing you with the care that you need and when you need it. And it is not only important to make this point from the perspective of hospitals, but also, as the mayor mentioned, the reinforcing the importance of your annual visits, all of those routine visits. We want to encourage you to be engaged and move forward right now, and it is essential to move forward in that regard. Again, our hospitals are safe. Our doctors and nurses are ready and waiting to provide that care, and should you need care in any district hospitals, please know that we are ready. Next slide. The other important points, we want to make sure that you're aware of the many steps that the hospitals are making to ensure that we are available and ready to take care of you. That includes putting important processes in place to protect our patients during emergencies and normal medical care. The providers have implemented a number of precautions to ensure that we have a safe environment, including the use of personal protective equipment. In addition, we are requiring the use of all masks for our staff, our patients, and our visitors. We are doing consistent screening for COVID systems at COVID-19 symptoms at entrances. There's increased cleaning protocols, especially in many of the frequently traveled areas. We have made hand sanitizers available throughout our hospitals. There continue to be restrictions on visitors. Again, we want to continue to ensure our priorities remain with our healthcare providers and our patients, and we are also engaged in many strategies around practicing physical distancing. And one of the things we want to remind our community, our residents, is that before you even give any consideration to canceling appointments, please contact your physicians. If you're having any symptoms that could possibly be an indicator of a medical emergency, such as chest pains, difficulty breathing, trouble lifting your arms, or weaknesses, our doctors recommend calling 911 or visiting your nearest emergency department. It is important to remember that delaying your medical treatment could make your health situation even worse and impact your ability to recovery. Accessing care can save your life. I would also like to say and encourage everyone, this is a call to action. We want to encourage particularly family members of vulnerable seniors or other citizens, use today to make your annual appointment day, to reach out to those who are vulnerable in the community and remind them that we cannot press pause on our health care, and that is extremely important that we don't delay care. So this call to action you will begin to see throughout the community with constant reinforcements. And as I am speaking from the Hospital Association, while that is important, I cannot stress enough the importance of reaching out to your primary care, your specialists, or other providers. Don't delay care. It could save your life.
Thank you, Dr. Robinson.
I'd like to thank you, Mayor Bowser and Dr. Nesbitt, for inviting us out to talk about this important topic. The American Heart Association launched this campaign, Don't Die of Doubt, for those reasons that Ms. Bowen just actually went through. Heart attacks, strokes, cardiac arrests, they don't stop because of COVID. And we know that up to 20 to 30% of people that came in to the hospital with COVID had cardiovascular events, so cardiovascular-related deaths across the country. So we don't want to forget those things. Next slide. Some of the signs and symptoms that you want to look out for as it relates to heart attack can vary based on the risk factors that you may have, Typical risk factors are diabetes, smoking history, immunosuppression. The classic signs are generally chest pain or chest tightness, generally with exertion, that goes away when you stop exerting yourself. In some populations, especially diabetics and women, they may have only shortness of breath as a cause or a symptom of their heart attack. So don't delay, don't ignore those symptoms. As Ms. Bowen said, the hospitals are getting safer and know how to triage patients when they come into the emergency room. Next slide. Some of the signs of a stroke. I give out the acronym of FAST, F-A-S-T. F is any face drooping. A, arm weakness. S, slurred speech. And T is most important, time. I can't tell you how many people that actually delay getting care because they're scared to go to the hospital or want to try to sleep it off. Time is of an essence when you're thinking about the brain and the stroke. So if you get in to get therapy right away, then the likelihood of recovery is much greater. Let's go to the next slide. So some of the COVID complications and the patient profiles that we look at that have higher risk are those with immunosuppression or immunocompromised states, say HIV. People have gotten chemotherapy for different cancers. Elderly patients, 65 is not necessarily considered elderly anymore, but those over 65 have a higher rate of complications from COVID. Diabetics, patients with heart failure, diabetes, high blood pressure, stroke, all have higher risks of complications when you relate to COVID care. So the Don't Die of Doubt campaign really focuses on educating the population and getting together with other organizations to encourage patients and our citizens to go in and seek care.
Thank you very much for those presentations, and thank you, Dr. Nesbitt, for your team staying in constant collaboration with our hospitals and medical providers throughout this pandemic. And we all recognize that your job is, of course, to help us respond to COVID, but every other aspect of healthy people in Washington, D.C. So with that, we'll take any questions. Yes, Sam.
Fall off in hospital business? Is that, is people just not coming to the hospital? Or what's the situation?
I'll go first. We have seen a decline in hospital utilization for many of our routine and other procedures, and we recognize that there are concerns and perhaps fear around utilizing the hospitals, and we want to reinforce as part of this campaign the importance of continuing with your routine care, but that the hospitals are safe, a safe place for you to be, and that our first priority is protecting their health.
Roughly 20 to 30% when you're looking at cerebrovascular events or stroke, down by 20% or so, and presentations for chest pain and heart attacks around 30%. And those conditions don't go away. Other conditions, say someone with abdominal pain who may have a treatable cause like an appendix rupture or something that could be more catastrophic, people are staying away from the hospital, and I've actually had to convince patients to go in and get care.
Doctor, it sounds like people may be dying by avoiding going to the hospital. Is that the indication of that?
That's the whole point of this Don't Die of Doubt campaign.
That's right.
If you want to quantify that, I'm just curious.
Well,
I can speak to that more definitively. And I believe you've asked this question of us a while ago, and I informed you that it was difficult in the very early stages of a pandemic for any state to be able to answer that question, and you need to have more time go by before you can look at your vital records and vital statistics. We've now been able to do a comparison looking at the same time period last year from January to May of 2019 and January to May of 2020, looking specifically at DC residents. And we've been able to look at what we would consider to be excess deaths. And we've seen a 40% increase of what we would quantify as excess deaths comparing January to May of 2019 to January and May of 2020. About 54% of those deaths are related to COVID, right? So we come here and we present every day the number of individuals who have lost their lives related to COVID-19. So 54% of those deaths, those excess deaths, are related to that. We've lost over 550 district residents to COVID-19, and their deaths will be classified as that. But 46% of the excess deaths that we've seen in the district are not related to COVID-19. So that means that we have to be looking at, well, what are the other causes of excess deaths that we are seeing in the district that could have been avoidable or excess? They're in excess of what we would see in the normal variation. And those things are related to pneumonia and influenza that aren't, again, we haven't been able to identify that that individual had a positive COVID-19 test. Cerebrovascular disease, as Dr. Robinson has mentioned, is one of them. Diabetes is a diagnosis that we're seeing people die of in excess of what we have seen in past years, and even if we look at what is the normal variation in a 5-year period. Cancers is something that we're seeing in excess of. And overdoses is also something that we're seeing in excess. Interestingly, in the same time period, we've seen almost a 50% decline in other accidents. So we've been able to do that analysis, and it's extremely important that people yield and listen to the advice of Ms. Bowens and Dr. Robinson, and recognize that it is extremely important to recognize that our hospitals and healthcare facilities have taken extreme precautions in terms of making sure that they are triaging people at the beginning of their visit to understand how to segment the population for those who are presenting with a COVID-related sign or symptom, to separate them from individuals who are presenting with other urgent and emergent issues, that people are consulting with their physician if they have a chronic health condition, to make sure that that chronic health condition remains managed and under control, so that if you have high blood pressure, you keep your risk of stroke and heart attack low, so that you don't become one of these excess deaths. And that we also have people who are going in for their annual visits and preventive care, so that we can diagnose these cancers that can become life-threatening for people and lead to an excess cancer death if they are not diagnosed timely and treated appropriately. So it's critically important that people recognize that pandemics have the potential to lead to a premature loss of life if people do not continue to seek the type of health care that is necessary to preserve life. It is not appropriate or helpful for individuals to be fearful of the doctors, nurses, and allied health professionals who can give them great advice and help to save their life. Okay, so that's what we want people to be able to understand.
One thing I did ask you, Dr. Nesbitt, months ago, and you said that there was not enough data. Was there a drop in things like venereal disease because people are isolating themselves more? Have you gotten any indication of that?
So, Sam, what we have been able to do is we are, again, continuing to monitor all of our health indicators, and we have not been able to, again, provide any analysis in this space related to sexually transmitted infections like chlamydia and gonorrhea or some of those other reportable conditions. What we have been able to observe, which is of concern for us, and I sent a correspondence to our licensed health professionals last week, is I am beginning to see some early signs that we are seeing individuals diagnosed with HIV at a later stage than we have previously seen in the district, which concerns us because we've made tremendous progress in HIV in the district. So we still can't make any definitive statements around whether or not we're seeing change in trends related to gonorrhea, chlamydia, syphilis, the other reportable STIs, but it's not something that is, again, alarming at this point, but we're starting to see more than what we have in past years with the time of diagnosis, and these are things like the number of the viral load for individuals, their CD4 count, things that we tend to measure that tells us how long a person may have been infected by the time that they're diagnosed. So we have deployed strategies already to be able to respond to that, allowing for people to do things to initiate PrEP, using telehealth, some at-home testing strategies for HIV, rapidly responding to this so that we don't lose the gains that we have made.
Thank you, Doctor. Any other questions? Yes, sir, James.
I'm curious, Dr. Nesbitt, when a district resident goes to their doctor, just for an annual physical, are they tested for COVID-19 here in the district?
So this is a great question that you asked, James, and the mayor has presented the data in terms of the number of tests that are happening at our district sponsored testing sites, but we continue to work collaboratively with our district healthcare providers who are in private practice, large group practices to equip them with the ability to offer COVID-19 testing in the routine office setting. And we are seeing increased testing happening in that environment, and it is our goal in our district testing strategy to continue to have a more robust testing infrastructure in our existing healthcare environment, meaning when you go in and you, before a routine test, routine exam, being able to request a COVID-19 test from your doctor and being able to have that need met. So that is our long-term strategy. We hope to have a much more robust operation for that by the late summer, early fall. We continue to partner with healthcare providers to understand what their needs are for that. Some of the things that are often cited is, again, thinking through the structural, physical redesign of their practice, making sure that they have the personal protective equipment that they need, and understanding what laboratories to use to send their tests. So we provide them technical assistance to help answer those questions.
Mark?
I'm wondering, well, one, if we could stay on these excessive deaths, I know you guys are, it seems like you're sounding an alarm here on this. Do you know, Dr. Nesbitt or the other doctors, are other jurisdictions around the country experiencing the same thing? Is this something common that we're seeing around the country? And how big of a concern really is this for you?
So it is a common theme in states and jurisdictions to experience this. The CDC has been commenting about this as well. It is also something that people warn of during pandemics, is that you want to be sure not to have epidemics arise as a result of managing a pandemic, and being sure to continue to allocate healthcare, medical and clinical resources to address other issues. It's why you hear us talking even about immunizations. You may have heard people talk about the importance of ensuring that other vaccine preventable illnesses still get attention while you're focusing on pandemics. So it is not uncommon for jurisdictions to talk about this and want to understand, if you are experiencing excess deaths, making sure that you don't attribute those fully to COVID-19 and that you're paying attention to what other factors may occur. We know, because we pay very much close attention to what is happening in our community, being able to be sensitive to the conversations that are happening in our community with people canceling appointments, not showing up for appointments. We know that there were some very intentional actions that happened with our hospitals and healthcare systems very early on to ensure that we were able to respond from a medical surge perspective. So some of the declines that happened in our hospital and health system volume was due to intentional actions. However, we know that there are some things that are happening because of individuals' fear. But these campaign messages are absolutely appropriate. Don't delay care, don't die of doubt. You need to know what is happening to your body, and you need to be able to seek preventive health services. But that physician consultation helps you to be able to make those decisions. And we've made very clear policy changes around increasing access and availability of telehealth. That utilization of those types of modes of healthcare delivery are really helping people make those decisions about what can be done over the phone, what can be done using an iPad, and what requires me to come in person. The important thing is to remain in contact with your healthcare provider.
And then can I follow up on the excessive deaths that are not COVID related, the 46% that are not COVID related? Do you have demographic data on that? Do you know if African Americans are disproportionately dying of excess in that category, just as they are in COVID-19?
Well, Mark, my response to that is that in the district, African Americans are disproportionately impacted every year, right? When we produce our reports at DC Health every year, we have African Americans and Latinx populations who are disproportionately impacted across our leading causes of death annually. And unfortunately, that has not changed.
Mark, you mentioned, you asked a question about whether it was local or more dispersed. Looking at data from January 1st through April 12th, there was a 29% decrease in 911 responses, a 31% decrease in heart attack and chest pain calls to 911, and about a 20% decrease in stroke cases. So they didn't just magically disappear. As a part of that, people have just stopped calling 911 for those cases.
And I would just like to reiterate to your point with respect to is this a unique situation in the District of Columbia? And just following up on Dr. Nesbitt's points, and with my colleagues, we are seeing this problem across the country. I routinely speak with my colleagues in Maryland, Virginia, Delaware, and Philadelphia every other week. And collectively, we are all focused on not delaying care campaigns and really reinforcing the messages that we've talked about, how important it is not to press pause on your care because it could save your life.
Yes, sir.
Hi, how are you? I just have a question real quick. If we can talk about Devin McNeil, the 11-year-old who was shot over the weekend. I know last month there was another shooting in that area, and it involved another dark-colored sedan, and they were firing what MPD said looked like semi-automatic weapons. There was surveillance video for that one. I'm asking for today, has there been surveillance video for this shooting of the 11-year-old this past weekend? And if so, how come that hasn't been made available to the public yet?
Well, MPD, as I'm sure you can imagine, is in the heat of the investigation, and they are going to use every tool that's available to them. And I don't think I can comment any further on the investigation.
All right, and I just have another follow-up question.
Sure.
If you don't mind. I know the violence has been up in the city at this point from last year, about 17% or so. I was just wondering if there was an updated numbers that we have right now as far as violence in the city with regards to shooting deaths. That's just available.
I'm happy to have MPD follow up with you on those data. I don't have it off the top of my head. I'm sorry. Yes,
Mayor,
Sam.
I'm just interested in your reaction to the council's activity yesterday, the budget.
I haven't been able to, I wasn't able to completely follow what they did, so I'm going to have to wait for my team today to have a complete summary of their actions. And I can't, if you have something specific, I may be able to comment.
Honestly, I think the meeting went quite long yesterday. I'm just interested in the police area. Did you have any?
Well, I think you know, Sam, that the council indicated that it would be slashing the budget for MPD, which I think they followed through on. And in that regard, it appears to me to be a shell game, that them moving dollars around from this to that. And we're going to have to dig into it. What it also appears is that the amount of the cuts will mean that our force strength will go down in the upcoming year to levels that it was at in the 1990s. And that, to me, is very unfortunate. And I think if those actions, or if that's what happened yesterday with the budget, they made the district less safe.
But from indication I got was that some of the things that they proposed, but kind of the non-monetary things, that meeting with you, a lot of that stuff is not actually taking effect. I mean, am I right? I mean,
I'm sorry, I can't follow what you're asking.
That the council members meeting with you kind of at least put on hold some of the things that they wanted to do in terms of changing policing in the city?
If you're referring to their emergency bill, again, I'm going to want to look at exactly what they did yesterday before I can comment on the emergency action. Yes, sir.
Mayor Bowser, you've been very firm in terms of taxes, saying basically we really don't need to raise taxes or implement taxes during this period of time. The council did otherwise in terms of the gas tax and in terms of upper income Washingtonians. Could you comment a little bit on that?
Yes, James. So what I want to be very clear about is that we were faced between this year and next year with over $1 billion worth of revenue losses. And we submitted to the council a balanced budget. And we balanced that budget carefully, prudently, with a mix of reductions in services, with sacrifices on the part of our employees, with prudently using our reserves. All with the eye that we have to weather this year and next year, that our recovery is uncertain based on the best information available to us, and that we were still, even with all of those challenges, able to robustly invest in public education, which we know is going to take a lot more to bring our kids back and to help them with the gap in in-person learning. We were still able to invest, as I've committed over the last 5 years, over $100 million in affordable housing. We were still able to propose ensuring that we have a diverse police department by expanding our MPD cadet program. We were still able to invest in our public libraries. So all of those things we were able to do in a budget that decreased, revenues decreased by over $1 billion without raising taxes. And I've said before, and I'll say now, I have no problem whatsoever going to DC residents and saying, as your mayor, with all of the information that I have, I think we need more revenues to run our city properly. I have no problem saying that. But I don't think that we were in that, I know for sure we're not in the position right now with this budget because we had a lot of tools at our disposal to balance without doing that. I also know that I can't see the future. And upcoming, maybe as early as August or September, or maybe by next year, we might have to revisit this budget because our revenues dive more. And if that's the case, where are we going to go to balance then? So that's why I urge the council not to resist the temptation to create new programs and new spending and raise taxes to do that at the same time that we're cutting our employee salaries, not cutting their salaries, but cutting their growth. And at the same time that we're cutting back on other programs. It doesn't make sense to me to raise taxes to support new spending. Yes.
So if I could ask some specifics about the budget.
Sure.
Yesterday, a 10% increase on gas per gallon. I mean, I know what you said overall on taxes, but just the specifics that were given preliminary approval yesterday, the gas tax and then the 3% tax on advertising sales and sales of personal information. What do you think about particularly the gas tax, of raising the gas tax?
Well, I have to tell you that there was very little discussion about either. I don't recall it coming up in the committee discussions. I don't recall it being discussed publicly so that residents or small businesses could weigh in. So I think that it's just problematic from that point. And I'm not that familiar with the council's analysis on the impact that this will have on DC residents or small businesses. So I would want to fully understand what their analysis shows. Generally speaking, the gas tax in DC doesn't raise that much because we have very few gas stations. So a lot of times what will happen is DC residents will go to other places close by to buy gas. So I think that this one probably doesn't have that much impact on DC residents. On the ad tax, I'm similarly concerned because all I hear about is our local newspapers being crunched because nobody is advertising right now. So then to add another cost on that, I think may have a very negative impact on local news.
And then could I ask about the police reform emergency legislation that I guess what you were set to sign yesterday, but they redid that, and now it appears from reporting and what we've seen yesterday that Councilmember Allen and the council acquiesced to many of your concerns with that emergency legislation. So I guess the question to you now is, will you sign it, and when would you sign it, putting that into effect?
Well, let me first, before I talk about the substance, and again, I want to read it before I comment on it, but the council, and it's every council meeting, they don't take a vote on Tuesday and then have a bill. I don't have a bill in front of me to sign, so I want to be clear about that. Sometimes they give me the bill in a couple of days. That's rare. Usually it's a week or more that I get a bill. This last emergency that you all were talking about and asking me about, I didn't get for 2 weeks. And then on top of that, I have a period of time where we review it for legal sufficiency, and then I am able to sign it or not sign it. So that's just some logistics that I want everybody to be aware of. So if you ask me tomorrow, are you going to sign the bill tomorrow? If I don't have it, ask them when are they going to send me the bill. So start there. The second thing is there were many elements of that emergency that upon very critical review, once we had the time to review it, were problematic. And I think the biggest issue that the council moved back on had really nothing to do with their stated emergency to address issues that we've been talking about post the killing of George Floyd. And they adjusted that. And in our view, it had no business being considered on an emergency basis.
What was that?
That had to do with the standards for stop. Yes.
Mayor Bowser, do you have any reaction to the vote that pushed the school security contracts from MPD?
That's a shell game. All it is a shell game, and I have no idea why the council would want again go back to a 1990s strategy. Keep in mind that DC Public Schools at one time managed the security contract. The DC Council, by law, moved it to MPD. And this was at a time, and sadly, it was another child killed in Ward 8 at Ballou High School. And so now the council, it appears, wants to go back to that failed strategy. And it was a reason they did it then, and I would argue that that reason persists. And that is that the public safety, the security, being able to work within the MPD bureaucracy, and that includes inside the school and the neighborhoods, is better situated to provide that public safety service. They also slashed the budget, which they argue that we don't need because kids are not going to be in school. So are not going to be in school the same number of hours or days. So I hope that that's the case, but I'm not sure. The other reason that I'm concerned is that we want the chancellor of schools focused on education. We want the chancellor of schools, who's now been added an additional very big responsibility about how to bring kids back and teachers back and staff back and in this COVID environment. And now they also have to manage a security contract. It's just not the best way, in my view, to run schools. And the council also, in my view, has provided no justification for doing that. Yes.
Do you agree with the council's decision yesterday to allow all felons from DC, whether they're in the DC jail or prisons elsewhere, to vote in DC?
Was that in the emergency?
Yes,
Was that in the wasn't that in the
new
previous
police-
emergency?
No, it used to be just if they were in the DC jail, and now it's anywhere.
Again, I want to look at, if they did some things on an emergency basis yesterday that I'm not fully briefed on, I'm not going to comment. Yes.
And I apologize if I get this wrong, but I believe they did something allowing you to extend the state of emergency or additional days, and if my math is right, I think the state of emergency set to expire July 24.
That sounds right.
So what are your plans with that as far as the possibility of either ending it sooner or extending it past July 24?
Well, Mark, I think at some point, and I've had this conversation with the chairman of the council, that our need for the state of emergency becomes largely administrative. I don't think we're at that point yet, but we need it to be in a state of emergency for all of our dealings with our federal partners. And so there may be some adjustment to how we talk about the public health emergency or the state of emergency, but we could need it for many months. We may not need it as much for the public health response operationally, but we will continue to need it administratively. Yes?
Mayor, as you look at the situation here, I know you had, I think, 73 new cases over since yesterday, but how do you assess it? But the situation here is not like Florida or Texas or California, and there's some criticism that perhaps they opened too soon. I don't know. What are your thoughts as you look at the situation here and sort of in this region and the situation in some of these other places where they're having much higher cases and the curve seems to be going up?
Well, Sam, and Dr. Nesbitt will give you her medical opinion and more than that, her public health opinion about that. But for us, I just feel like we don't know what this virus is going to do. We have followed the best medical advice and public health advice nationally and locally. We think that we've acted prudently and in a way that best serves the health of our residents, and we're going to continue to do that. There's some things that are within our control, what we do within the borders of the District of Columbia. We can't control everybody in the region, and we certainly can't control everybody nationally. But we are a country with porous borders, so anybody from Texas or Florida can be in DC in the next hour, and we won't be able to control that. We also, another very, very big aspect, we think, of managing cases in the district is that everybody's not coming back to work at the same time. Again, we can control our employees. We can't control everybody in the private sector and certainly not everybody in the federal government. So all of those things have a big impact. We also could not control mass demonstrations in our city that they happen, or other large-scale events that happen on federal parcels. So there are many things that we can control. I think that our team has done an exceptional job. And more than that, DC residents and businesses have done an exceptional job of following the advice of our public health professionals. And when I think about the number of people who came out to watch the fireworks on the National Mall last year compared to this year, it was evidence to me that DC residents are taking very seriously blunting the curve and doing everything that they can to stop the spread of the virus.
Did you have numbers on that? I was just curious.
Do I have what?
Numbers on the numbers who came this year?
The best objective numbers that we have, Sam, are from Metro ridership. And I don't know if you know off the top, Chris, what they were.
Yep, Sam, so across the system on July 4th, there's 38,000 rides. Compare that to last 4th of July, over 400,000. So clearly, to the mayor's point, many people stayed at home to celebrate the 4th.
38,000 compared to 400,000.
Yes.
Yes, Julie.
I know twice in the past few days you've had to reset the community spread decline, which is something that I think continues to confuse people, how those numbers work, that you don't go back to zero. Can you explain that and your reaction to having to reset that?
We've explained it a number of times, but let me just say, I think what's really important with this is that this is I read something yesterday, I can't remember which article, that seemed to suggest that we could hit phase 3 when we hit 14 days of community spread decline. And Dr. Nesbitt has been very careful, in fact, emphatic, to say that isn't the goalpost for entering phase 3. So if I could ask Dr. Nesbitt to talk about that, because I know we've been in the first, and I get why people are want to do that because we've done it for the first 2 phases, but there's more that we need to know for phase 3.
Yeah, thank you for that, Madam Mayor. And it's something that we want people to understand. And as I've thought about how to make this even clearer, is that if we get people to understand that there's a quantity and a quality to how we assess and evaluate where we are from a public health perspective. The counting of the 14 days is for us to look at the quantity of what is happening. But we also have to assess the quality of what is going on, which is why we add additional metrics and why we say there's more than one metric that helps us make decisions to advise when it is appropriate to move into phase 3. Continuously only observing the 14 days of decline and saying, well, as soon as the district makes 14 days, they should move into phase 3. We have cautioned against that for every phase, but people still only want to look at that. But you're missing the whole point of the quality of what the pandemic looks like in the district. You're missing the ability to understand what widespread community transmission looks like versus localized transmission versus if you only have sporadic cases. If you start at 1,000, you can hit 14 days of decline and be at 900, right? And that still means the quality of what the virus transmission looks like at your community could still be exceptionally poor. You've got so much virus circulating in your community, it would be reckless and irresponsible to allow for high-risk activities like bars and nightclubs and other large-scale venues to open. So that's the thing that people have to really understand about this. We're going to move into phase 3 as soon as we hit 14 days of decline. It's the same thing we cautioned around with phase 2, and we explained the technical things that were happening with our new contact tracing solution. So that's what I really want people to understand about that. In terms of the resetting, we've explained to you too that as we get new data, more people are getting tested, that there's going to be periods of time where you have to reset. We've explained the complex statistical thing. I don't know how else to explain it over and over again. So I think at some point we're going to have to acquiesce and recognize that some people will grasp it, some people won't, and you just look at the dashboard and see where we are and rest with that. So that's how I'll end that.
Okay, a couple more. Mark?
Mayor Bowser, ACLU just released a press release and video from the protest outside Black Lives Matter Plaza, which appears to show MPD officers using munitions against protesters, which they say contradicts Chief Newsom's assertion that the day the president moved to St. John's Church, MPD did not participate in that move, did not deploy munitions.
Where was the video from?
ACLU just released it.
But where was it?
This
What did it? Where did it show? It was at Lafayette Square.
It was, yes.
Okay, I'll have to look at that. I'm not familiar with that video.
Have you gotten any updates that would make it clear to you whether or not what DC MPD's role was that day, that in fact that maybe they did participate in helping the president make that move?
No, I have not gotten anything that would suggest that. Yes.
Yes, I have a question for Dr. Robinson. Dr. Robinson, there are some in the community who believe that the way you get a heart attack is through 2 modes. Number 1, you're too old, and number 2, you work too hard. And with those type of perceptions, what is the best way for a district resident not to get a heart attack during the COVID-19 period?
Well, that's certainly a myth, because I have patients that are unemployed that have heart attacks and that aren't as stressed out, and people that are in their 30s. So certainly you want to look at the major risk factors that are common in most of our cities, especially in major urban areas: diabetes, hypertension, high cholesterol. Those are sort of like the tip of the iceberg when you think about the risk factors that contribute to a heart attack, but there's a bigger issue we call health equity and the social determinants of health. So transportation, housing, security, policing, all those factors play a role in precipitating cardiovascular disease and other chronic conditions. So we can't look at just one particular factor and say you should go out and walk more or you should live in a better neighborhood, because we know that can't happen. There are people that are in environments that they don't feel safe going out for a walk. Or there may be a liquor store or carryouts on every other block, right? So they may have to take a couple of buses to get to a good grocery store. So it's not that simple when you talk about putting a cookie cutter mechanism to help decrease those risks of strokes, heart attacks. You can play a role in being more active, certainly. You can play a role with watching the kind of diet that you have. And it's not always more expensive to eat healthier when it comes to that factor. So it's a community, it's a group effort that will have to help. As I said, policing, housing, transportation, food securities or food insecurities that'll have to play a role in helping to reduce that.
And let me just say this is that in like a year's time, I lost 3 people in my circle to heart disease or heart attack who were all less than 50, and in a couple cases in their early 40s. And one was a woman. And so I just want to, at that point in time, for everybody that I knew, I always asked them the question, have you had a checkup? How's your blood pressure? Are you taking your medicine? Also, all of those things I think are huge myths. Young people drop dead of heart attacks, sudden death all the time. And we have to definitely dispel the myths of only being elderly and only being a man or only being this or that, to pay attention to your heart health and managing chronic illness.
If you go into any dialysis center in the city, you'll see younger African American men and women in some of those dialysis centers, and some of the complications are from diabetes and hypertension.
Okay. Thank you very much, everybody.